Welcome to Holistic Health, where we explore all aspects of health and wellness to help you thrive. Whether you're seeking advice on managing anxiety or simply looking for tips to improve your overall well-being, you're in the right place. We believe in fostering a supportive community where everyone can learn, grow, and thrive together. Our goal is to provide evidence-based information, practical tips, and resources that empower you to take charge of your holistic health journey. Don't forget to subscribe and join our growing community of wellness enthusiasts. Understanding and dealing with OCD. Obsessive-Compulsive Disorder, or OCD, is a mental health condition that affects millions of people worldwide, yet it remains misunderstood by many. In this video, we will take a deep dive into what OCD truly is, how it manifests in daily life, and most importantly, how individuals and their loved ones can effectively manage and cope with the condition. By the end of this video, you'll have a clearer understanding of the challenges faced by those living with OCD and the tools they can use to manage its impact on their lives. What is OCD? To begin, let's define what OCD is. Obsessive-compulsive disorder is characterized by two main components: obsessions and compulsions. Obsessions are unwanted, intrusive thoughts, images, or urges that cause significant anxiety or distress. Compulsions, on the other hand, are repetitive behaviors or mental acts that individuals feel driven to perform in response to an obsession, with the goal of reducing the distress caused by these thoughts. Importantly, people with OCD often recognize that their thoughts and behaviors are irrational, but they feel unable to control them, creating a cycle that can be incredibly challenging to break. Common misconceptions. Before we move forward, it's important to address some common misconceptions about OCD. Often people casually refer to themselves as OCD when they describe their desire for order or cleanliness, but this trivializes the experience of those who actually live with the disorder. OCD is not about simply being neat or organized. In reality, it's a debilitating condition that can consume hours of a person's day and cause immense emotional and psychological distress. For example, someone with OCD might be paralyzed by the fear that something terrible will happen if they don't perform a specific ritual or check something repeatedly. To better understand how OCD works, let's look at what we call the OCD cycle. First, the individual experiences an obsession. This could be a fear that their hands are contaminated after touching a doorknob. The obsession causes anxiety, which leads them to engage in a compulsion, such as washing their hands multiple times in a row. While this may provide temporary relief, the cycle quickly repeats itself when the obsession returns, and the person feels compelled to perform the ritual again. Over time, the compulsions can become more complex and time-consuming, further entrenching the person in the cycle. OCD can have a profound impact on various aspects of daily life. For some, it affects their ability to perform at work or school due to constant distractions and rituals. Social relationships may also suffer because people with OCD can feel embarrassed or overwhelmed by their compulsions, leading them to avoid interactions or hide their condition. Additionally, the emotional toll of living with OCD can lead to feelings of hopelessness, frustration, and even depression. In severe cases, the disorder can become so overwhelming that it prevents individuals from functioning in their everyday lives. Types of OCD. OCD presents in different ways, and understanding the various types can help in identifying and managing the condition. One common type is contamination OCD, where individuals fear germs, dirt, or other contaminants, leading them to engage in excessive cleaning or avoiding certain places altogether. Another type is checking OCD, where individuals repeatedly check things like locks, appliances, or their own actions to ensure nothing dangerous or harmful has occurred. There's also symmetry and ordering OCD, where people feel compelled to arrange items in a particular way, or perform tasks in a specific sequence to feel right. Intrusive thoughts. OCD involves unwanted, often distressing thoughts or images that may be violent, sexual, or blasphemous in nature. While these are just a few examples, OCD can manifest in countless other ways, each presenting its own set of challenges. So, what causes OCD? While the exact cause isn't fully understood, researchers believe it's a combination of genetic, neurological, behavioral, and environmental factors. Studies have shown that OCD can run in families, suggesting a genetic predisposition. There is also evidence that certain brain regions involved in decision-making and emotion regulation may function differently in people with OCD. Additionally, traumatic or stressful life events can sometimes trigger the onset of OCD, especially in individuals who are already predisposed to the condition. It's important to note that OCD is not the result of personal weakness or character flaws. It's a legitimate mental health disorder. Now let's talk about treatment. The good news is that obsessive-compulsive disorder is highly treatable, and many people can manage their symptoms effectively with the right combination of therapies. Cognitive behavioral therapy, or CBT, is one of the most effective treatments for OCD, specifically a type called exposure and response prevention, or ERP. ERP involves exposing the person to their feared situations or thoughts without allowing them to engage in their compulsive behavior. Over time, this helps them learn that the anxiety will naturally decrease on its own, even without performing the compulsion. Medication can also be helpful in treating OCD, particularly selective serotonin reuptake inhibitors, or SSRIs. These medications help to regulate the levels of serotonin in the brain, which can reduce the severity of both obsessions and compulsions. In some cases, a combination of therapy and medication provides the most effective results. In addition to professional treatment, there are self-help strategies that can make a difference in managing OCD. One key strategy is practicing mindfulness. By learning to observe their thoughts without reacting to them, individuals with OCD can reduce the power of their obsessions. Another helpful approach is developing a structured daily routine, which can provide a sense of stability and reduce anxiety around decision-making. It's also important to educate loved ones about OCD. Family members and friends can provide invaluable support, but they must understand that accommodating or enabling compulsions can reinforce the OCD cycle. Instead, they should encourage the individual to engage in healthy coping strategies and seek professional help. While OCD can be a lifelong condition, many people live fulfilling and happy lives with the right support and treatment. It's important to remember that progress may be slow, and setbacks are a normal part of the journey. Recovery from OCD doesn't mean the complete absence of obsessions or compulsions, but it does mean learning to manage them in a way that allows for a higher quality of life. For those living with OCD, it's crucial to be patient with yourself and recognize that seeking help is a sign of strength, not weakness. Over time, with dedication and the right tools, it is possible to regain control over your thoughts and behaviors. And for those supporting someone with OCD, offering compassion, understanding, and encouragement can make a world of difference. In conclusion, obsessive-compulsive disorder is a complex and often misunderstood condition, but with greater awareness, understanding, and access to effective treatments, individuals with OCD can lead fulfilling lives. Whether you're personally affected by OCD or know someone who is, the key to managing the disorder lies in seeking help, learning healthy coping mechanisms, and breaking the OCD cycle. Together, we can break the stigma surrounding OCD and provide the support needed for those who are struggling. If you found this video helpful, please don't forget to like, share, and subscribe for more mental health content. Your engagement helps spread awareness and empowers others to seek the support they need. Thank you for watching and take care of your mental health.